Every year, a very large number of strokes happen to people who had warning signs beforehand and didn't recognize them for what they were. Not because the signs were invisible, but because they didn't look the way most people expect a stroke to look. No dramatic collapse, no clutching at the chest, sometimes nothing more than a slightly drooping smile or a sentence that came out a little wrong. And because stroke treatment is one of the most time-sensitive situations in all of medicine, that gap between something feels off and we need to call 911 right now is often the single biggest factor in whether someone recovers fully or lives with permanent damage. Today, I'm going to walk you through exactly what a stroke is, why timing matters as much as it does, the warning signs that get missed most often, the version of these symptoms that shows up differently in women, the difference between a stroke and a warning stroke that's just as important to know, the risk factors within your control, and exactly what to do in the first few minutes if you suspect it's happening. This is a longer video than usual, and that's intentional because this is genuinely one of those topics where understanding the details can be the difference between someone walking out of a hospital or not. Let's start with what a stroke actually is, because the mechanics matter for understanding everything else in this video. A stroke happens when blood flow to part of the brain is interrupted, which starves brain tissue of oxygen. Brain cells begin dying within minutes of being cut off from blood flow, which is why strokes are sometimes described as a brain attack, using the same logic as a heart attack, except the affected organ is the brain instead of the heart muscle. There are two main types. The first and far more common type, making up the large majority of strokes, is an ischemic stroke caused by a blood clot blocking a blood vessel that supplies the brain. The second type is a hemorrhagic stroke, caused by a blood vessel in or around the brain bursting and bleeding into surrounding tissue. The underlying causes and treatments for these two types differ significantly, which is part of why professional diagnosis and treatment matter so much and why this isn't something to try to sort out at home. Here's the part that makes timing so critical. There's a phrase used throughout emergency medicine. Time is brain. For ischemic strokes specifically, there's a category of clot-dissolving medication that can be given in the emergency room, but it only works within a certain window of time from when symptoms began, typically discussed in terms of the first few hours. Beyond that window, the risks of the medication can outweigh the benefits, and the option may no longer be available at all. In some cases, depending on the specific location of the clot and the hospital's capabilities, a mechanical procedure to physically remove the clot may still be possible somewhat later, but even then, earlier treatment consistently produces better outcomes. This is exactly why medical professionals emphasize getting to an emergency room immediately rather than waiting to see if symptoms improve on their own. Every additional hour without treatment generally means more brain tissue affected, and that has a direct relationship with how much someone recovers versus how much permanent impairment they're left with. Now let's get into the warning signs, starting with the ones most people have actually heard of, because there's an easy way to remember them. The acronym FAST. F is for face. Ask the person to smile and look for one side of the face drooping or looking uneven. A is for arm. Ask the person to raise both arms and look for one arm drifting downward or being unable to lift at all. S is for speech. Ask the person to repeat a simple sentence and listen for slurred, strange, or garbled speech, or an inability to speak at all. And T is for time. If you notice any of these signs, the time to act is immediately. Call 911 and note the time the symptoms started, because that timestamp genuinely matters for the treatment decisions doctors will make. Many hospitals and stroke associations have expanded this to BE-FAST, adding two more letters. B is for balance, a sudden loss of balance or coordination or difficulty walking. And E is for eyes, sudden vision changes in one or both eyes, sometimes described as blurred vision, double vision, or a curtain coming down over part of the visual field. Those are the well-known signs, and if you only remember one thing from this video, remember FAST or BE-FAST because it genuinely covers the majority of cases. But now I want to spend real time on the signs that get missed, because this is where the actual danger lives. Not in ignorance of FAST, but in situations where the symptoms don't quite match what people expect. The first commonly missed sign is sudden, severe confusion without any obvious physical symptom alongside it. A person may seem disoriented, unable to follow a conversation, or suddenly struggling to understand simple instructions without any facial drooping or arm weakness at all. This gets explained away constantly as tiredness, as having an off day, or in older individuals specifically, it's sometimes mistaken for a symptom of dementia rather than treated as a medical emergency in its own right. The second missed sign is a sudden, severe headache, often described as the worst headache of someone's life, with no clear cause. This is a classic warning sign of a hemorrhagic stroke in particular, and it's frequently dismissed as a migraine or tension headache, especially in someone without a history of severe headaches. The third missed sign is sudden numbness or tingling, particularly when it's confined to one side of the body, one arm, one leg, or one side of the face. And especially when it comes on suddenly rather than gradually, which is a different pattern than the numbness most people are used to from sitting awkwardly or minor nerve compression. The fourth commonly missed sign is a sudden problem with coordination or an unexplained fall, especially in someone who is not typically unsteady on their feet. This one gets attributed to tripping, being tired, or simple clumsiness far more often than it gets correctly identified as a possible stroke, particularly when there's no other obvious symptom alongside it. The fifth missed sign is difficulty swallowing that comes on suddenly, sometimes noticed only because someone starts coughing or choking on food or liquid they've never had trouble with before. The sixth is a sudden and severe episode of dizziness or vertigo distinct from ordinary lightheadedness, especially when it's accompanied by any of the other signs we've covered, even mildly. And the seventh, and one of the most important to understand, is any of these symptoms appearing and then going away within minutes to a few hours. This is what's known as a transient ischemic attack, or TIA, sometimes called a mini stroke. And I want to spend a moment on this specifically because it is dangerously easy to dismiss. A TIA happens when blood flow to part of the brain is temporarily blocked, causing stroke-like symptoms that then resolve on their own, often within minutes, sometimes up to 24 hours as blood flow restores. The critical thing to understand is that a TIA is not a lesser event to shrug off. It is one of the strongest warning signs that a full stroke may be coming. Research has consistently shown that a meaningful percentage of people who have a TIA go on to have a full stroke within the following days to weeks if the underlying cause isn't identified and addressed. This is precisely why the symptoms went away, so it must not have been serious, is one of the most dangerous assumptions someone can make. If you or someone you're with experiences even brief stroke-like symptoms that then resolve, that still requires an emergency room visit and immediate medical evaluation, not a "let's just keep an eye on it" approach, because the resolution of symptoms doesn't mean the underlying risk has resolved. I also want to specifically address how stroke symptoms can present differently in women because this is a genuinely under-discussed piece of this topic, and it contributes to real delays in treatment. While women absolutely experience the classic fast symptoms too, research has found that women more frequently report a set of less specific symptoms that can be easily mistaken for something else entirely, including sudden fatigue, general weakness rather than one-sided weakness, nausea, chest pain, shortness of breath, and a sudden change in mental status or level of alertness. Because these symptoms overlap with so many less serious conditions, they're more likely to be dismissed, both by the person experiencing them and sometimes even in initial medical evaluations. If a woman experiences a sudden, unexplained combination of several of these vaguer symptoms together, particularly alongside any degree of confusion, weakness, or speech difficulty, that combination deserves the same urgency as classic fast symptoms, not a wait-and-see approach. Let's talk about who's at higher risk, because understanding this helps you know when to be more vigilant for yourself or for someone you care about. Age is a factor. Risk increases as we get older, largely because several of the underlying causes of stroke, including high blood pressure and irregular heart rhythms, become more common with age. High blood pressure is the single largest controllable risk factor for stroke because sustained high pressure damages blood vessels over time and makes clot formation and vessel rupture both more likely. Atrial fibrillation, an irregular heart rhythm, significantly raises stroke risk because it allows blood to pool and clot inside the heart, and those clots can then travel to the brain. Diabetes, high cholesterol, smoking, obesity, and a sedentary lifestyle all contribute as well, largely through their combined effects on blood vessel health. A previous stroke or TIA substantially raises the risk of a future stroke, which is exactly why any prior event, however minor it seemed at the time, warrants ongoing medical follow-up rather than being considered a closed chapter. The encouraging part of this list is that most of these risk factors are things you can actually influence, often significantly. Managing blood pressure through medication when prescribed, along with diet and exercise, meaningfully reduces stroke risk over time. Getting an irregular heartbeat evaluated and treated, if you've noticed one, addresses a major and specific risk factor directly. Quitting smoking reduces risk substantially, and the risk reduction begins surprisingly quickly after quitting rather than requiring years to show benefit. Regular physical activity, even moderate amounts like a daily walk, supports healthy blood vessels and blood pressure. And managing diabetes and cholesterol through whatever combination of diet, medication, and monitoring your doctor recommends rounds out the majority of controllable risk. None of this eliminates risk entirely, since factors like age and family history aren't within anyone's control, but the controllable factors account for a substantial share of overall stroke risk, which is genuinely worth acting on. Now let's cover exactly what to do if you suspect a stroke is happening, because the order and speed of these steps matters enormously. Call 911 immediately. Do not drive yourself or the person to the hospital if there's any way to avoid it, because paramedics can begin certain assessments and notify the receiving hospital before you even arrive, which saves critical time once you're there. Note the exact time the symptoms started or the last time the person was known to be symptom-free, because this timestamp directly affects which treatments are available. While waiting for help, keep the person calm, have them sit or lie down safely, and do not give them anything to eat or drink, because swallowing difficulty is common with stroke and creates a choking risk. Do not give aspirin or any other medication unless specifically instructed to by emergency dispatchers, because aspirin is appropriate for some strokes and potentially harmful for others, and this is a determination that needs to be made with proper medical assessment, not guessed at in the moment. If the person loses consciousness, check that they're breathing and place them in the recovery position if you're trained to do so safely. Stay with them and continue monitoring until paramedics arrive. I want to spend a moment on recovery too, because a stroke diagnosis, while serious, is not automatically a permanent sentence to significant disability, and the earlier point about timing connects directly to this. Rehabilitation after a stroke, often involving physical therapy, occupational therapy, and speech therapy depending on which functions were affected, can produce meaningful recovery over the weeks and months following the event, and the general medical understanding is that the brain retains a genuine capacity to adapt and rebuild certain functions through this kind of therapy, a concept referred to as neuroplasticity. The degree of recovery varies enormously from person to person and depends on factors including the size and location of the stroke, overall health, and how quickly treatment was received, which circles right back to why recognizing the warning signs early and acting immediately gives someone the best possible starting point for whatever recovery process follows. If you're a family member, spouse, or friend of someone at higher risk for stroke, there are a few practical things worth knowing. Learning the fast and be fast signs yourself means you're equipped to recognize a stroke even if the person having it isn't able to advocate for themselves, since confusion and speech difficulty are themselves symptoms that can prevent someone from recognizing or communicating what's happening to them. If you live with or regularly check in on someone with known risk factors, high blood pressure, atrial fibrillation, diabetes, or a previous stroke, or TIAA, it's worth having a specific, practiced plan for what to do, including knowing which hospital in your area has stroke-certified emergency capabilities, since not all emergency rooms are equally equipped to deliver time-sensitive stroke treatments. And if you ever notice even a brief resolved episode of stroke-like symptoms in someone, please don't let its disappearance talk you out of seeking emergency care. As we covered, that's often the most important warning sign of all. Before we close, let's clear up a few myths because they tend to create dangerous hesitation at exactly the wrong moment. Myth 1. Strokes only happen to elderly people. Not true. While risk does increase with age, strokes can and do happen to younger adults, and rates in younger populations have been a growing area of medical attention. Age is a risk factor, not a requirement. Myth 2, if the symptoms go away, it wasn't serious. As we covered in detail, this is exactly backwards. Resolved symptoms may indicate a TIA, one of the strongest predictors that a full stroke could follow. Myth 3, there's nothing you can do until you get to the hospital, so it's fine to wait a bit and see. Also not true, the specific treatments available depend directly on how much time has passed since symptoms began, so waiting directly reduces treatment options rather than being a neutral choice. And myth 4, stroke symptoms are always dramatic and obvious. As this entire video has covered, many of the most commonly missed presentations are subtle, confusing, or easily mistaken for something else entirely, which is precisely why understanding the fuller range of symptoms, beyond just the classic fast signs, matters so much. Strokes are time-sensitive medical emergencies where minutes genuinely determine outcomes, and the gap between recognizing what's happening and acting on it is often the single most important factor within anyone's control in that moment. The fast and be fast signs cover the majority of presentations, but the subtler signs we covered today, sudden confusion, a severe unexplained headache, one-sided numbness, sudden loss of coordination, sudden difficulty swallowing, severe vertigo, and any resolved but real stroke-like episode, too, are just as important to recognize, precisely because they're the ones most likely to be dismissed. If this video was useful to you, please share it with someone in your life, because the value of this information isn't in you remembering it for yourself, it's in you recognizing it in someone else during the moment it actually matters. Subscribe for more evidence-based health content, and I'll see you in the next one.